Innovations in Wet Lab Training. The authors have no financial interests.
Dr. Kumar, a first-year resident, is experiencing dizziness, sweating, a racing heart, and an adrenaline rush. You might think he is having a heart attack or that he's in love, but no, it's his first cataract surgery on a patient. A review article from 2015 estimated that among the approximately 18,000 ophthalmologists in the United States, only 9,000 perform cataract surgery regularly. Counterintuitively, as cataract surgery has evolved from extracapsular cataract extraction to phacoemulsification, and more recently, femtosecond laser-assisted cataract surgery, so too has the learning curve for mastering these new techniques and managing intraoperative complications. The increasing surgical complexity of cataract surgery over time is driven by periodic revolutions in technique and instrumentation. Cataract surgery requires extreme precision, meticulousness, as well as advanced hand coordination and fine motor skills. Hence, for ophthalmology residents, surgery can become a nightmare if they are not adequately and efficiently given wet lab practice prior to starting in the operating room. There are a library of options available for surgical training: wet lab, skills lab or dry lab, and advanced mentoring. Human cadaveric eyes are ideal in size and dimension, as well as for best approximating the tissue feel. Conventional eyeball holders lack a reliable fixating mechanism that is essential for keeping the eyeball stable and firm during wet lab training. Thus, a novel device was developed at our institute, the Spring Action Apparatus for Fixation of Eyeball, or SAFE, consisting of a hollow iron cylinder with a small hole in the wall for inserting a spring action 5cc disposable syringe. When the eyeball is placed over the device, the syringe generates suction, drawing the eyeball into the cylinder, enabling proper fixation for wet lab training. Animal eyes, especially pig and goat eyes, can be very cost-effective for wet lab training. Animal eyes tend to have clear lenses which do not realistically simulate a human cataract. To harden the nucleus of animal eyes, injecting intralenticular formaldehyde or alcohol. However, the much larger size and dimensions of the animal eye create difficulty in manipulation of instruments to perform phacoemulsification. The lens thickness of a goat's eye is nearly twice that in humans, thereby allowing implantation of the human cataractus nucleus into the goat's lens. Once the goat's eye is mounted, a standard clear corneal incision is made, followed by a 5 to 5.5 mm capsulorhexis, initiated with the cystotome and completed with the capsulorhexis forceps. Part of the lens matter is removed using minimal phacoenergy and low vacuum settings to create a bed for the human nucleus obtained during manual small incision cataract surgery. The surgical wound is then extended to about 6 mm in size, and a frozen human cataractus nucleus is implanted in the cortical bed within the goat's capsular bag. The wound is then sutured, and the goat eye is now ready to be used by the trainee surgeon. Difficulty in procurement and limited availability of storage options for both human and animal eyes prohibit sequential practice in the wet lab. 3D eye models circumvent this problem. Three-dimensional printing has come a long way since it was invented in 1980. With cumulative improvements in the resolution, accuracy, cost-effectiveness, and speed of this highly customizable manufacturing process, it has become the future of medical education. The anatomical and structural fidelity has allowed learners to view and understand gross pathology and structural relationships prior to surgical intervention. 3D printed eye models, such as the Bionico model, help assess instrument control, incision size, rhexis centration, and suturing prior to performing phacoemulsification. Kitaro wet lab models, designed with realistic but synthetic materials, allow repeated practice of techniques and procedures. Considering the high cost of these commercially available 3D eye models, we designed a 3D eye model using CAD software and MarkerBot replicator printer. The ABS material, an opaque thermoelastic polymer, has impact resistance and rigidity required for 3D printing an eye model. Mastering hand positioning and ergonomics are critical for stable and precise instrument manipulation to increase safety during surgery. To emphasize the importance of proper hand positioning, which is often underappreciated, we have employed a microscope-mounted wide-angle camera to record optimal hand positioning in ocular surgery. The concept of Skills Lab or Dry Lab, the IC Surgical Simulator augments and accelerates ophthalmic surgical training with objective assessment of skills. The virtual training simulation improves training confidence and understanding of techniques, while also allowing practice and development of specific technical skills. A few companies have applied virtual reality, or VR, and augmented reality, or AR, concepts in their surgical training products, which increases cognitive skills of the trainee. Virtual reality simulation also allows the delivery of more immediate, objective, and automated performance assessment compared to the human expert. A review article on the available surgical simulators in cataract surgery training proposed that virtual reality simulators are an effective tool in measuring performance and differentiating trainee skill level, and may be useful in improving surgical skill and patient outcomes in cataract surgery. An article published in the JCRS also concluded that the preoperative simulator training prepared residents for the operating room as effectively as the wet lab. Augmented reality. Once a figment of the imagination, augmented reality is now one of the most promising digital technologies. It has not only revolutionized the field of entertainment, retail, and education, but it has now come to the field of ophthalmology as a cataract surgery training system with dexterous instrument tracking technology. Although the virtual simulator is a much more sophisticated tool for surgical training, it is limited to specific simulated task training rather than comprehensive training. Though feedback sensation may not be perfectly realistic, the cerebellar training through reiterated movements is beneficial. Telementoring. Assessment of a student's surgery can be performed by experts across the world in an internet-based platform aptly referred to as real-time telementoring. It is cost-effective and enhances skill transfer, especially in remote, low-resource areas. It significantly lessens trainee travel time and length of stay to learn techniques in higher resource areas. Artificial intelligence incorporated with surgical mentoring will be the unparalleled virtual surgical assistant that marks the epitome of future wet lab training.
Your Oscar scoring is 97. You may now begin the surgical procedure.
Ophthalmology is considered a late adopter of simulation technology. Most importantly, patient safety is improved by overcoming the steepest part of the learning curve.